Hello, guys. This is Dr. Palaniappan Manickam. I cannot be so excited. I've never been excited this ever in my life. I'm going to meet Dr. Satchin Panda, who is my guru, my pioneer. The pioneer in time-restricted feeding. And the weight that I have lost, everything is because of him. So I thought I will bring him on board and then ask all the questions that you guys have asked me. So that we can get the answers directly from the guru. So without wasting any time, let's bring him in. Okay. Hi, Dr. Panda.
Hi, I'm happy to be here. Thank you for bringing me in.
Thank you so much. I just want to let you know, let the audience know that there are two different kinds of doctors. So I am a clinical doctor. I see patients every day. And we are seeing patients using medications, using research trials based on the findings provided by scientists and doctors like Dr. Panda. So without them, we are nothing. So the basic core science is being targeted at basic science level. So Dr. Panda deals with mice, looks into all the research in mice and then say, hey, you know what, this is working in mice, this is supposed to work in humans. That is what is happening. And so the first question to you, Dr. Panda, is how did you find the circadian rhythm and weight loss link to start with? What made you think about in that line?
Well, the thing is, our body is not the same between midday and midnight. So, for example, in the morning, you're more hungry, you are likely to eat a big meal, and your stomach is ready to digest it. All that good things happen in your metabolism. But in the middle of the night, if I wake you up in the middle of the night and give you a very nice bowl of salad and everything, first thing is you will be irritated that I woke you up. And second thing is your body, your organs are also irritated because they're actually in the rest and rejuvenation phase. So when you feed your body when it is not ready, then the body doesn't know what to do with the food. So it will just take and store it like fat. So that was the idea, that our body has certain functions at certain time. And if we can align when to eat with its internal program, then maybe we can have healthy weight. And our body will be programmed to burn some excessive calorie that we have stored. So that was the simple idea.
So you started looking into mice receptors based on this concept.
Yeah, so the original experiment was very simple and straightforward. We took two identical sets of mice, and I guess you have shown it in your YouTube channel again and again. But it was really the mind-blowing observations that we saw at that time, because for last 150 years, nutrition science has told us that what you eat, the quality of food you eat, and how much you eat matters. What we did was we took identical sets of mice born to the same parents in the same cages, and they had the same genes, same microbiome, they had the same number of calories, and from the same food. The only difference was the first group of mice ate whenever they wanted, and then the second group of mice were fed only within an 8 hours interval in the first experiment. And after 16 to 18 weeks, we were surprised that the second group of mice that ate within 8 hours interval, they were completely protected from obesity. They were much healthier. They actually ran around much more. And you suspect that if the mice are eating for less number of hours, they may be weak. But we put them on treadmill, mouse treadmill. And the mice, when you put them on treadmill, they will run for around an hour. And when mice eat whenever they want, they will run maybe 45 minutes because they're also eating unhealthy food. We're surprised, these mice, which were actually eating unhealthy food, but within 8 hours, they ran for almost twice long, like 90 minutes. And that was mind-blowing to see how come these mice are so fit. And then we said, okay, so we put them on rotating drums, so they have to coordinate their hand and leg movement. So it's much more complex task, and they were even much better. So, and of course, when we opened up these mice, unlike your patients, actually my mouse patients, I can do surgery at the end. I can do and take out organs and then look at them. And to our surprise, these mice had no fat in their liver. There's very little fat in their body. The only fat they had was very good fat. Now there are many shades of fat. white fat is bad, and then the beige, and then the brown. So they are more beige and brown fat. They're much better insulin regulation. So all the good things happen.
So the fat is gone.
Yeah.
Nice. So I'm a living example, right? So I lost so much weight just because of this simple technique. But I'm telling all my patients and also all my audience here in the YouTube channel is that let's say you follow this time restricted feeding. I can guarantee you that you will not have any GI symptoms at all, to a point that I will not have a job.
No, I won't go to that extent. It's the biggest thing is yes, it's very powerful in prevention, but
so
people who already
I was focusing on the acid reflux. I've seen so many patients, they come in with this omeprazole, pantoprazole, all these acid blocking agents, and we just implement this simple technique, and all of a sudden they don't need any medication.
Yeah, that's very powerful, and that's something that we have seen, that time restricted eating completely changes the gut microbiome. What happens is our stomach actually has a rhythm, daily rhythm, and acid production. So that means, every time we eat, our stomach has to produce acid to digest the food. If you eat the same food late at night, then our stomach produces more acid, disproportionately more acid. And second thing is, the acid actually comes up, and then our mouth, our saliva, neutralizes that acid. But at night, we're programmed to reduce saliva production, because unless we reduce saliva production, we'll be drowning in our sleep. So we have less saliva production to neutralize the acid. And if we eat more food late at night, then we produce more acid. And then the third thing that happens is our GI tract actually goes to sleep. So that means our small intestine doesn't move that much. So the food just stays in the stomach.
Right.
So that's, I think, one reason why if we eat late, then we have more acid reflux.
I can tell you from my patient experience as well, right? So, not only in terms of the medications, the biggest problem that people are doing in terms of heartburn is that they go to sleep right after they eat, and mainly they are having at bedtime. So the first thing that we always do is to do not eat late at night. That is the number one thing that is written on the GERD handout that we give. But people don't focus on that, and people go directly to the medications. Okay, omeprazole 20 milligram daily. Okay, how much should I take? How much should I take? But anyway, so in my personal experience, I can tell you that I have been implementing this technique to all my GI patients, not only with GERD, fatty liver, big time, and IBS, irritable bowel syndrome. I'll tell you my experience, and you tell me whether you're seeing this in your mice study as well. So patients come in with fatty liver, time-restricted feeding, elevated liver enzymes first, and then 3-4 months later, liver enzymes come down. In addition to that, the fibrosis, the scar tissue in the liver, gets reversed from stage 3 to stage 2. Do you see that in mice?
So actually, almost 10 years ago, the first time when we published our paper, that was the biggest surprise. When we opened up the mice on time-restricted feeding had no fatty liver disease. Absolutely none. And then what we did, we sectioned the liver and then sent it to a pathologist who was blinded to the mice. And he scored the Brunt score, which is the fibrosis score. And clearly saw that the time-restricted feeding reduced the Brunt score. The fibrosis was very low. And subsequently, we have put many mice, different types of mice, even mice that have a bad gene, mice with genes that will make them more prone to fatty liver disease. And if we put them on time-restricted feeding, then the fatty liver disease is reduced or completely eliminated. So that's why we think that this, the point is the liver stores fat, and that's why you get fatty liver disease. The fat should be stored in the fat tissue. And by time-restricted eating, during the fasting time, the liver can export that extra fat to the fat tissue. And second, the liver can also burn that extra fat within the liver. So that's what we see when we do more sophisticated analysis because we can take out the mouse liver, we look at the genes and enzymes. What we find is time restricted feeding just supercharges this pathway or the mechanism that burns fat within liver. So that may be the mechanism.
How about IBS patients? Like I have patients with severe IBS, like IBS diarrhea. They go to the bathroom like 8, 10 times a day. And we change them. Oh, change this diet. Oh, low FODMAP diet. Oh, keto diet. But since I've been doing this, I've been implementing that as well to my patients. And I can tell you like 50 to 60% of patients are getting better.
Yeah. So again, this is where we look at when mice go to poop. And mice actually go to bathroom almost 10, 15 times throughout the day and night. But then when we put time restricted feeding, so this also we observed in a very weird way because we're trying to see whether the mice are pooping out a lot of fat or so we're collecting mouse poop throughout 24 hours. What we found was the time restricted fed mice don't actually poop for almost 12 hours. So they go to the bathroom only 4-5 times, but not like 10, 15 times that the other mice do. So it was very clear in mouse experiment too.
Is it because, I mean, the more the time restriction, the better the outcome?
I won't go to that extent because, there may be some people who are a little bit sensitive to time restriction, fasting. They might go to hypoglycemia. In real life, our mice are not on medication, but in real life, a lot of people are on different medications,
Right.
particularly diabetes medication if they're on some kind of sulfonylurea, which is still popular in India.
Right.
That can cause little hypoglycemia. So I would say, in my recent book, the Circadian Diabetes Code, we tell that people should start with 12 hours eating first, and then slowly shrink that to 8 hours, 10 hours, and maybe 8 hours. And if they still see they can tolerate this, they're not going hypoglycemic, then maybe they can stay at 8 hours.
Right. So the biggest question is what everybody is asking is, like when you implement this technique, they are concerned about side effects. What side effect is hunger pain. I'm waking up in the middle of the night with hunger. What do you tell your patients?
Well, the thing is, it is it's conceivable that in the first 1 or 2 weeks, people will wake up with hunger. It's not going to kill you. Hunger is a good sign that your stomach is actually empty and it's going into repair phase. So it's a sign that your stomach. So the thing is, every day we do a lot of damage to our stomach. You just imagine if you're non-vegetarian, if you're eating a piece of meat or chicken or fish, whatever it is, your stomach is digesting that meat. And stomach itself is made up of meat. So that means a lot of damage happens to the stomach lining. It has to repair itself at night time. And just like you cannot repair a road when the cars are moving, you cannot repair effectively your stomach lining when you have food.
Food, right.
So when your stomach empties and you're feeling hungry, so that's a good sign that your repair phase has just started. And if you can tolerate it for the first 1 or 2 weeks, then from second or third week, you won't even feel that hunger.
Right. So the other, I think it's a fad. I think so that what we are talking about is not technically intermittent fasting. Can you tell us the difference between time-restricted feeding versus intermittent fasting? The reason I'm asking that is many patients will say, oh, I'm doing time-restricted feeding. I start my first bite at 2 p.m. and my last bite at 10 p.m. So I still belong to an 8-hour window. Can you share your ideas on this?
Well, the thing is, when we first published that paper, we said 8 hours time-restricted feeding is beneficial. 8 hours is not a magic number. The reason why we did 8 hours was convenience. Then we have done 9 hours, 10 hours. We find very similar results. So intermittent fasting is a very broad term. which means that you have to reduce. Fasting means you have to reduce your calorie intake from your average calorie or what your body requires on one or more days in a week.
Right.
So that's the broad term. Whereas time restricted feeding is a very different term. It doesn't say that you have to reduce your calorie explicitly. If you can, that's okay. But in all the mouse experiment that we do, we make sure that the time restricted fed mice actually eat the same number of calories as the control group. The only thing is we align it to a time when the body is more prepared to digest food and do better. So just imagine if you if you're a gardener or if you're trying to grow a plant, let's say a rose plant, and then you know that you have to water the plant. But it doesn't mean that you have to put the rose plant under your sink and water 24/7. That's going to kill the plant.
Right.
And you cannot do intermittent fasting on the rose plant because you just cannot stop watering for 4 or 5 days in a week. The idea is you got to just water enough. And time restricted feeding is just like that. You water your garden just enough at the right time, and it will take care of itself. So that's why we say time restricted. You are restricting to a certain window in the day, and we don't use the word fasting because people think that fasting is depriving your body of something that it needs.
It needs.
Whereas time restricted feeding is you are feeding the body at the right time every day.
But how about people doing 2 p.m. to 10 p.m. every day?
Well, 2 p.m. to 10 p.m., that's also time restricted feeding. They just call it intermittent fasting or whatever they can call it. It's a semantics. The practice is the same. Like it's so you might say that, well, they're starting at 2 p.m., going till 10 p.m. Is that good or bad? I mean, it's scientifically in scientific literature, there is nothing that says that 2 p.m. to 10 p.m. is intermittent fasting and everything else is time restricting. That's just what the popular media has latched on to.
But they're missing the effect of circadian rhythm if they do that, isn't it? From 2 p.m. to 8 p.m.
So yeah, I mean there is a convenience factor that some people think that they can just get up and skip their morning meal and then go to 2 p.m. to 10 p.m. and it may be okay for many people because for a lot of people they need to have dinner with their family or the business dinner, which happens usually late at night, and they're adapting to that. So in our experiment, what we have found is any time restriction is better than no time restriction. So it's almost like doing exercise. Any exercise is better than no exercise.
Right. Good.
And then in this case, whether you're doing in the afternoon or morning, there will be some differences. For example, if you're doing from 2 p.m. to 10 p.m., then it's likely that you'll still eat a lot of unhealthy food, many desserts, sweets, and alcohol, because all of those things are consumed late at night. Whereas if you start early, then you're actually unintentionally, you'll improve your nutrition quality, irrespective of what happens. Means reducing alcohol, reducing
the
calorie dense diet, and also reducing all the unhealthy food is always better for you.
So that brings up the next question about the weekday versus weekend, right? That is the biggest deal breaker. All of my patients say, I'm so good at for the first 5 days. The next 2 days, I just go haywire, like 8 p.m., 9 p.m.
So that's we did that experiment in mice. So we actually let the mice party in the weekend. So we let them eat whenever they wanted, and these mice actually overeat in the weekend. They eat more than the mice that have ad libitum access to food all 7 days. But still, they had almost 80% benefits of the time restricted fed who eat religiously all 7 days within 9 hours. So skipping, kind of getting out of the window for 1 or 2 days is not that bad. But in practice, what happens is, if you're doing time restricted eating, and if you eat late at night on Saturday, Friday, or Sunday, then on the next day, your body will remind you because you'll feel more groggy. You might have acid reflux at night. You might lose good night of sleep. So that's what happens. There is a positive feedback loop that it reminds you that you did something that you're not supposed to do.
So similar to hunger at night, how about lack of sleep? So they're saying, oh, I'm waking up in the middle of the night because I don't have enough food, I feel, if I eat by 6 p.m.
Well, so that's, as I said, it might happen for 1 or 2 weeks, and then later on, people get used to it.
Okay.
And if you're still hungry, then maybe the type of food people are eating. So, for example, if you eat a lot of high carb diet, then you're more likely to digest that much faster, and then you might feel hungry. But the point is that hunger is not going to kill you. It's actually curing you, because that's when your autophagy starts, your body starts to burn up all the toxic chemicals it has, it's repairing itself. So that's kind of a sign that this is a good thing. It's almost like, you're driving on the road and there is road construction. You get irritated that, hey, the traffic is slow and I'm stuck here. But imagine if that road construction doesn't happen, repair doesn't happen, then you'll be stuck in traffic forever. So this is an inconvenience, but it's a necessary inconvenience that will give you long-term benefit.
Long-term benefits, right? And the other question people ask is, oh, can I have black coffee with cream? Or my Indian patients, everybody is asking jeera water in the morning, lemon water in the morning. And while they cook for family and they are tasting it, will this considered as their first bite?
Well, the thing is, we have to go back to the basics again. So, for example, if that our blood glucose is considered healthy when it's below 100 milligram per deciliter. An average person of your size or my size will have 5 liters of blood. And if we squeeze all the sugar out of 5 liters, we'll get 5 grams of sugar, which is 1 teaspoon of sugar. And when you add just 1/5 of that teaspoon, then that becomes 120 milligram per deciliter, which is at the borderline of diabetes. So the bottom line is, even if you have half a teaspoon of sugar to your tea or cream or whatever it is, and that means you're waking up your pancreas to do its job, to bring the blood glucose down to below 100. So this is really amazing that it needs only 1 or 2 grams of sugar extra.
Wow.
To kick your pancreas into high gear to produce that insulin and use that extra glucose.
Okay. Okay. Biggest question, as you know, is Indian patients are working overnight with the overseas job. So shift workers, basically. People ask me, what should I do? I'm working at night. My shift starts at like 9 p.m. and ends at 6 a.m.
Yeah, so that's a very big concern, because the bottom line is this: we lived on this planet for 200,000 years, and only in the last 200 years after industrialization, we built an anthropogenic world, man-made world, without paying attention to the importance of circadian rhythm. So that's why we have shift work, and it's entirely up to the whims and mood of the manager or the person who is in charge. They can do this shift schedule. It's not science-based. But now we know that if there is only one thing that will disrupt your circadian rhythm and will make you prone to many diseases, this shift work. It's to an extent that World Health Organization has categorized shift work as a potential carcinogen. It can actually cause cancer. Imagine, there are many chemicals, those are considered as carcinogen. But shift work itself, this lifestyle of staying awake all night, working, can bring you to many diseases, forget about those, even to cancer. So this is a big concern. Now the question is, what can you do? Because at the same time, we say, who are the shift workers? Shift workers are the ones who are essential for the civil society to work.
Right.
So these are the cops, the firefighters, the essential workers, the
doctors.
Sorry?
Doctors.
Yeah. Doctors, yes, of course. Everybody who gives health, economy, and service to continue. So we call them the heroes, and superheroes and Wonder Women. But at the same time, superheroes and Wonder Women, they also need healthy lifestyle. So the question is, what can they do? So few things that they can do is, if you have your say on how shift work should be scheduled, you can be on shift work continuously for 10 days and then take 4 days off. And that way you are on one schedule, and you can kind of time your eating to the time when you're working to some extent. Of course, don't eat too close to the end of your shift, because after the shift ends, you want to come back and sleep. So at least you can eat till midnight or 2 a.m. or something if you're on overnight shift. And then after you come back, you got to invest some money into making a completely dark bedroom. Because it's really hard to get that 6 to 7 hours of restorative sleep during daytime, because our body is not designed for that. And you need some extra care. So that's why use eye mask or light out curtains and a cooler room to try to get that sleep. And also involve your family, so they have to understand that they cannot just ask you to go and do your shopping and attend the parent teachers meeting and all this other stuff during the daytime. They have to be supportive. It's a very fine line. You're working really hard. You're doing and you are kind of on the edge of a knife, and if you make little mistakes, then it can have a huge impact. And then shift workers, another thing is, most shift workers who are in IT and in even medicine, and they do have good health insurance and health coverage. And most of the time we ignore to do even our annual checkup. So it's better to go get your annual checkup done to see whether your triglyceride, lipids, or blood glucose are aging towards unhealthy, and then act on it. And particularly exercise becomes a big part, because exercise can benefit a lot of these factors.
Exactly.
So we are actually doing a very specific study to see whether people like firefighters who do 24-hour shift, can they do 10 hours time restricted eating? Because we think that everybody has to eat to stay awake and do their job. But actually what we find in mice, for example, when they eat within 10 hours or 8 hours, they have more endurance, they have much better motor control, motor coordination, and to some extent, in some cases, we see they even have more grip strength, which is resistance exercise. All of these are needed for firefighters. So we have a study that's going on, and it's almost coming to an end, and we'll soon publish that to see whether they can do it, and if they do it, are there any benefits? So I'm super excited about that study.
I'll tell you a study that you should do on overnight on-call gastroenterologists who are being called in for doing scopes at night.
Yeah. No, I'm serious. So that's why we built this app called My Circadian Clock, and the way the app is built, we can run multiple parallel studies in different countries, different physicians. So if you are eager and if you have the IRB to get the ethics approval, then we can also proceed to do some of these studies.
Nice. So the other thing is, my patients always they are, I mean, including me, we are not patient. We want results right away. So I start my time restricted feeding. I want to be losing weight of 10 pounds within a week. What is the average expectation? When does the body fine tune? And what is your experience?
Well, the thing is, it depends on how you were eating before, because if someone was eating over 16 hours and then goes to 8 hours, of course, that person will have a very quick change in body weight or maybe body matrices. But if you're already at 10 hours or 12 hours eating window, and if you're going to 8, of course, you may not see that immediate benefit. But at the same time, some of the immediate benefits are not necessarily weight loss. Means we see a lot of people who are a little bit overweight or little plump, but at the same time, they're super healthy.
Right.
So what determines healthiness is Is your inflammation down? Are you sleeping better? If you're sleeping better, then you're full of energy in the morning and you can do a lot of executive tasks throughout the day. Is your GI system healthy? If you're not having any GI problems, no acid reflux, then that's a huge thing because that affects so much of our body.
Absolutely.
And what we're finding in one very crucial study that we did recently, we put both old male and female mice on time restricted eating. What we found was the female mice are not losing much weight, but the female mice were way much more healthier than the male mice on time restricted feeding.
Wow.
So they had very low inflammation. They're
Mhm.
super insulin sensitive, so they didn't have any sign of diabetes. And both in mice and in humans, when women, for example, get fatty liver disease, then they have a very rapid progression of that disease. They go to fibrosis, NAS, and all this stuff happens very quickly. And in mice, the same thing happens. But in mice, what we found was female mice are more protected from fatty liver disease.
Wow.
And then they had almost no, very negligible amount of inflammation in their fat tissue, although they had healthy amount of fat, because we have to also accept that we are designed in a way that women need to have a little bit extra fat. But that fat has to be healthy, and that's what we found. And then finally, what we found was at the end of the experiment, since it was COVID going on, we said, what happens if we infect the mice with a pathogen and see how they survive, how they fight the immune attack? And if male mice eat whenever they want, then nearly 80% of male mice would die because of this infection. And if there's time restricted feeding, then 50% will survive. So there is some benefit. But the female mice, if they're on time restricted feeding, none of the female mice died. Means they were not losing weight, but they were completely resistant to this infection, bacterial infection. And that was really mind blowing, because you don't have to lose weight to get all these benefits. What you have to do is you have to fine tune your immune system and metabolism in a way that you are more resilient. That's what we need. We need resilience. We have a lot of stress, a lot of mental stress, nutritional stress, and physical stress. And can we tackle the stress and still be healthy? That's the biggest question.
So that we can be ready for COVID-22. Let me ask you this. Do you recommend your patients to eat particular kind of diet during the eating window?
Well, so what happens is, as you pointed out, a lot of people, they find themselves super hungry in the middle of the night. And the hunger comes if you eat a lot of processed food and your body is quickly metabolizing that. The best example is complex carb and simple carb. The simple explanation is, if you take powdered sugar and put them in water, and you are allowed to mix that water only 10 times with your spoon, almost all powdered sugar will dissolve. So it's almost like digesting all your carbohydrates, simple carb. But if you take a big, I don't know what you call misri, we used to call those big chunk of sugar, you put that and stir 10 times, you may lose only 10% of it. So that's the difference between complex sugar and complex carb and simple carb. So we tell people to pay attention to the carb type that they're eating. So if they eat more complex carb, then the stomach will slowly digest it. And second thing is, complex carb also helps the gut microbes, because the microbes don't like the simple sugar. The truth is, our body absorbs all the simple sugar. There is nothing left for them to eat. And when you eat this complex carb, whether it's oatmeal or any of the complex things, then you're actually feeding them, because your body is eating half of it, and then the other half you're feeding your gut microbes. So that helps them. So that's one thing that we tell, that it's always good to kind of slowly change your nutrition quality. And we see that people inadvertently do that, particularly those who start time restricted eating early and they have their early morning breakfast. because in a day, breakfast is the only meal on which we have complete control. Because once you get out of the house, what you eat depends on the cafeteria or bistro or the restaurant or whatever is served to you. And the night, if you're going to business dinner or somebody has invited you to their house, then it all depends on what your host is going to serve. So
Potluck.
control. Yeah, potluck. Yeah.
I used to say that the number of potlucks will determine the size of your belly pot.
Yeah, because you want to test everything, and if you don't test, then people will be very sad and mad. And in India, they'll say, "Oh, why are you taking so little? Take more."
Absolutely.
Yeah.
Hospitality, we are known for our hospitality, but I think it is affecting us in different way.
I think hospitality just sends you to hospital. That's it.
So complex carbs. How about protein and fat?
Yeah, protein and fat are also important, because particularly for vegetarian, because the best source of protein in vegetarian diet is dal or chana and all this stuff, and
Right.
they have only 25% of their dry weight as protein, and you cannot eat too much of that. So then you're really limited by how much protein you can ingest. On an average, we should eat, say, somewhere between 0.6 gram to 1 gram of protein per kilogram of body weight per day. I think for anyone over the age of 50, it's a good target to have 1 gram per kilogram, because if you're targeting 1 gram per kilogram, you may end up with 0.8 or 0.6. So in that way, what becomes very clear is you have to be really mindful about how much, if you're vegetarian, how much of lentils and all these nuts you are consuming, because that becomes your prime source of protein. The good news is these days there are also many protein powder and other stuff that are available. You might try, depending on whether your stomach can take it or whether you like it. But it's important to pay attention to that protein.
Protein, right? The protein content, actually, I made a controversial post that I said, don't eat non-vegetarian. Non-vegetarian actually kills your bacteria in your small intestine. Vegetarian actually promotes bacterial good microbiome, so they'll provide immunity. And that's it. Nobody is inviting me for dinner anymore. Do you feel that? Do you have any research on that?
Well, the thing is, the non-vegetarian, particularly in Indian subcontinent, we add a lot of masalas and oil and fat. So then it becomes really very difficult to figure out what is its impact on our gut. And there are a lot of papers now showing that meat can disrupt your gut microbiome on long term. And these are some good concerns. But at the same time, there is also cultural values. We are the creature of cultures. And so that's why we have to kind of strike a good balance between those two, because some people are just born to be, they are so used to eating non-vegetarian food that they cannot thrive on vegetarian food.
Right.
Another thing is
to limit at least once a week or 2 times a week, something like
that.
Yeah,
it's better to limit that. When it comes to non-vegetarian food, egg is a very good source of protein, and if you just eat egg white, and it's even way much better, because there is no extra oil going into it. If you just boil it and eat it. And in many Western dishes, people actually eat very simple non-vegetarian food. So you steam the fish and then they put little garlic sauce.
That's the first dinner that I had when I came to US. I was like, that's it? Is there anything else that's coming, or that's it? So let me ask you this. The other question is different time zones, right? So India, same time throughout the country, California, Eastern time, Canada time. So let's say a patient is following time-restricted feeding from 8 a.m. to 7 p.m. of 11-hour eating window, goes to London or even US. Should they have to adapt to that style?
The rule of thumb is, after waking up, wait for an hour, at least an hour, or maybe 2 hours before your first bite. Second is, and this is, I also explained that in my recent book, the Diabetes Code, Circadian Diabetes Code, that just in the morning, in the evening, 2 to 3 hours before we go to bed, our melatonin levels begin to rise. And melatonin, just like it makes our brain to sleep, it also makes our pancreas to sleep. So that means your pancreas may not produce enough insulin to take care of the carbohydrate in your diet. So that's why it's always better to pay attention to when you sleep and when you wake up and adjust your timing accordingly. So for example, if someone is waking up at noon and going to bed at 2 a.m. every single day, and for him or her, it's okay to start at 2 p.m. because this is 2 hours after waking up, and then go till 10 p.m. or 11 p.m. But whereas someone who is waking up at 4 a.m., for him, waiting till 2 p.m. and then going to eat till 10 p.m. and then going to sleep at 10:15 or 10:30 is not a great idea.
Not a great idea. So we should remove all the wall clocks and then just have our internal clock. So other question I had was the exercise. So I mean, I've read in the past that exercise is better in the afternoon around like 2-3 p.m. Is that what do you say?
Yeah, so that's we are designed to have more physical activity towards the end of the day, because our ancestors, the hunter-gatherers or the farmers, when they went to the field, they'd be working all day, but then when it was evening, there was no electricity, so they had to run back home. And in the evening, people who stayed home, or the kids, they had to also take care of the livestock, and because evening was very scary. I don't know about you, but once I was in Africa, and in Africa, this part I was in Africa, there was no electricity, so it's very scary when it's dark. So we are designed to be more physically active in the afternoon. Second thing is, when we look at our muscle and connective tissues, they're also more primed to do more physical activity with less risk for injury in the late afternoon. So that's second reason why we should be more active, because we have low risk for injury. And then the third one is, from the morning, our best glucose insulin response is in the morning, and throughout the day it slowly goes down. But our body uses glucose in two different ways. One is insulin dependent way to absorb glucose. Another one is, which is not very well discussed, it's insulin independent, exercise dependent way. So when we exercise, our muscles become like sponges. They can pick up insulin, glucose. And towards the end of the day, since we are producing less insulin, it's better to do exercise, because that will soak up, that will compensate for the less insulin function, so that just by being physically active towards the end of the day, you can also absorb more glucose from it.
Wow, super. I think, when you explain similar to how we were born, ancestors, that concept, I think that sounds very reasonable, and it is approaching to patients. I think that is why this time restricted feeding sounds very, very juicy to my mind. And mainly for patients with diabetes. I know, to all my audience, Dr. Panda has a book called Diabetes Circadian Code. It's available in Amazon, that's where I bought. It may be available in other stores as well. I would absolutely recommend you to read it. I'll put a link in the description. It is absolutely amazing. I know it's a big book, but can you summarize briefly in a minute or two about time restricted feeding? Is it safe in diabetes? How should they proceed, or should they not do it at all?
I think everybody can do some forms of time restricted eating. It's just which window. What I say is, anyone from 10-year-old to 100-year-old can consistently eat within, say, 12 hours and see health benefits. It's almost like brushing your teeth once a day. But then, depending on which medication you are on, you may choose to go to 10 hours time restricted eating. And many of our clinical trials are also done on 10 hours, because we think that that's something that people can stick to for a long period. It can be a lifestyle, not an intervention for 7 to 8 weeks. And even if you're doing 10 hours for 5 days, and due to societal pressure or personal pressure, you have family pressure, you have to eat outside for 1 or 2 days, that may still be okay. And 8 hours is a little bit tricky for people with type 2 or type 1 diabetes, because they, depending on your medication and the stage of your diabetes, your blood glucose may show a big swing. I think for them, if you have access to a continuous glucose monitor, then it can help you to figure out whether you can go to 8 hours time restricted eating and can still do it. But I have seen quite a few people are successful to gradually go to 12 hours and then 10 hours and then 8 hours.
So slowly.
And then 10 hours is like brushing your teeth twice a day, so you go to dentist less. And then 8 hours is like brushing your teeth and flushing your teeth so that you stay in good health.
You can be in the Colgate ad. Let me ask you this. So our Indian lifestyle is not only Indian lifestyle, in general, everybody lifestyle has been tuned to like late night gathering, wedding, anything. They're just focusing on the night part of it. Do you think as a society, how do we change this, and what can we do to help at an individual level? Because all my patients are saying that, I'm willing to do it, but my wife, my kids, or my husband, my kids, or my society is not ready to change.
Yeah, so that's a big question. And if you think about it, our health, well-being is all tied to what we do between sunset and midnight.
Right.
Because the daytime, we are all busy in earning our money and living. But that's also a time when we want to socialize, because the cradle of civilization is actually from the fireside chat. The hunter-gatherers, they came back, or the farmers, they came back, they cooked something, they ate, they talked, they socialized, they sang, they danced, they talked about philosophy, politics, marriage, setting up events, arranged marriage. All of this happened at nighttime. But then at one point, we kind of pushed the envelope too much, because it's okay to go till 9 or 10 p.m. But then now we have fireside chat that goes till midnight.
Along with chat.
Along with, yeah.
Along with
so this is where, and also when we think about our own independence of freedom, we are tied to what our employers want us to do or what our family want us to do till evening. And then after dinner is the only time when you are free, when you're truly human. We can use our creativity and all that stuff. So that has become a societal challenge, that how to manage those 5 or 6 hours. And if we come up with a different way, so for example, we have to change the cultural practice in a way. So for example, if I'm a vegetarian and if I go to somebody's party and then I say I'm vegetarian, they will be very respectful. They will find something that I'll eat. Same thing. If I say, no, I actually don't eat anything after 6 p.m. or 8 p.m., then people should be able to accept that. Just like people are accepting vegetarianism or veganism, or, in India, people do all types of fasting or religious thing. Some days they eat fruit. So we have to have acceptability. And another thing is, for us, we also have to figure out how to kind of juggle those. For example, I go to late night gatherings and then I say that, look, I don't eat at night. If they're not ready to accept that, then the next time I go, I say, well, I had a bad stomach, I cannot eat anything. When you say bad stomach, nobody will force you to feed. You can have sparkling water with lime, and you can have very good discussion. You can get all the other people get drunk or get bloated with food, and you can enjoy that.
So nowadays, I go with the tiffin box.
Yeah.
I put everything to eat the next day.
Yeah, I mean, this is something that you can do. That's a great idea, because I have seen some people do that. They will bring the tiffin box. They will say, yes, I like whatever you made and I would like to enjoy it. Please pack them and I'll eat them next day.
The
So I think
only
we have to
problem-
bring that cultural awareness. Yeah.
The only problem is my tiffin box is pretty big that there is nothing left behind.
That's okay. I mean, you can eat for the next 5 days until somebody else calls you for another dinner.
So, Dr. Panda, the reason that I got interested in all this was I lost my close friend. He was like only 40 years old, 2 years older than me before. And then because of arrhythmias, and then he was obese and he has coronary artery disease. So I think the healthy concept is slowly imbibing, and I think the people are trying to understand more that, hey, what, health is more important than wealth, which is what we have been trying to focus a lot more.
Yeah.
So for young patients or between like 25 to 45 years of age, I think that is very, very crucial. If they don't take care of them at that period of time, they are just set up for failure towards the end as well. One last piece of advice that you can tell those patients for me.
Well, you're putting me on a hot seat.
Because they don't listen to me that much.
No, I guess this is true. I mean, when I just turned 50, and I see that most of my classmates from high school or from college, they are on medication. And my challenge was, can you be 50 without any chronic medication for any chronic disease? That's the simplest challenge. And the thing is, people do things not because they want to be healthy. We don't do things to be healthy, to be very frank. We do things to earn a lot of money, or we do things to achieve some bigger goal. But the question is, what is your goal? Do you really want to play with your grandchildren? And if it is so, then you have to stay healthy. And if your goal is to generate wealth, do you think you can travel around the world without being hooked up to a machine so that you live your full life? I guess we have to put some different kind of goals that actually entice people to be healthy.
No, absolutely. I just love it. People say that, why are you doing all this? You're going to live for 100 years. So it is not a matter of living up to 100 years. Even if living up to 10 years, it's the quality of life.
Yeah. And then another thing is, in the entire human history for 200,000 years, our average life expectancy was always less than 40 years. Only in the last 100 years, particularly in India, we have crossed that 40 or 50 years mark. So that means you can say all this stuff about our ancestral knowledge and all that stuff. Those ancestral knowledge kept us alive only up to 40 years. And now that there is so much known about how our body reacts to nutrition, sleep, and physical activity, those are the three things that we can do, all of us can do. And in India, people say that, okay, we are genetically predisposed to have heart disease, and we don't do exercise. But at the same time, I would bet that mostly Indian males and Indian women, if we exercise, we get more benefit for the same exercise than other community, other ethnicity. So that's something that we have to keep in mind, that even a small amount of exercise for us goes a very long way. And we should keep that in mind.
That's why I think, we were focusing on building our career and not building our muscle.
Yeah.
When we were young. Yeah. But anyways, thank you so much, Dr. Panda. This was amazing. I mean, it's a fanboy moment for me. Thank you again for your wonderful research. Please keep doing all these researches so that I can implement your findings on my patients so that everybody can get benefit to create a healthier community.
Yeah. Thank you. Have a wonderful day and have a perfect circadian day.
Thank you, Dr. Panda. Thanks a lot.
Okay, bye-bye.
Thank you. Bye.